Hi, take two. This is the preclinical introduction to advanced clinical practice. We've decided to do this in a recorded fashion so that everybody gets essentially the same introduction, which will help create a nice level playing field for all the students in all the clinical sites. We will at least start with the same fundamental expectations. I'm going to be going over the course packet in pretty good detail because this clinical is, well, it's advanced. And you won't be doing anything that you haven't done before, but you're going to be doing more of it and some greater, higher acuity patients you'll be working with. So we're going to talk about what we, the instructors, expect of you, what the clinical sites expect of all of us, and hopefully when we do that clearly, everyone will succeed better. If you understand what I want or what Vani or Joy or whoever may be teaching your clinical group, if you understand what they expect, you have a better chance of giving it. So that's what we're going to be doing today. I'll probably break this into two sections, two sections, and just so to keep these small and easier to watch on YouTube or whatever you watch it on. So we're going to be talking about advanced clinical practice. Now, the course packet will, of course, have your clinical schedule for whatever facility you're in. We hold advanced clinical in 4 different hospitals, scattered between Sheboygan, Manitowoc, and Two Rivers. And each of the instructors has their home base. If you get me, I'll be at Holy Family. And that provides some variability. Obviously, every facility has some differences in how they operate. That's normal. You won't find 2 facilities anywhere that operate exactly the same. You won't even go within Aurora and find 2 facilities that operate exactly the same, even though they're both Aurora. They will have a lot of commonalities, but every facility, every unit within a facility has their idiosyncrasies. So I can't get into all of those differences that you'll experience. I'm not going to even get into the Holy Family idiosyncrasies, which I'm most familiar with, because, to be honest, if you don't go to Holy Family, it's not going to really matter. And those of you that are at Holy Family, we'll talk about that very briefly before clinicals begin. So I'm not going to get into that level of detail, just to clarify that. If you have some experience at one of these hospitals and you wonder how your experience will coincide with the course packet, that would be a really good question to bring to your instructor the first day of clinical, or even before clinical starts, via email. The quicker and earlier we can communicate our expectations and our answers to your questions, the better everyone will be. And very likely, if you have a question, somebody else does too. So don't be afraid to send us emails with questions, because we want to make sure that you understand as much as possible so that you have the fewest worries as you go into clinical. We know, as instructors, we know that all of you are worried when you go to a new clinical site. That is to be expected. What we try to do is minimize your worries to the things that we can control, and part of that is giving you the answers to your questions. So look in the course packet, look for your facility and your dates of clinical, and make sure that you understand when you have to be there, what time you're there. Every facility has different start times, end times, because we operate within the facility's environment. So make sure you understand when you need to be there. This is a very good time to right now put all of these dates on your calendar, be it a paper calendar, your digital calendar, because you all have digital devices, they probably have calendaring on them. Make sure that if you have children or a husband or a wife, that they know when you're going to be gone. Communicate to everybody, because this is an intense clinical. You will be very busy. There's a lot that is expected of you. Everybody around you needs to understand that too. So I'll be repeating that several times, that there is a lot of work here. It's doable. It is. We have never had a student die while in clinical. That's a joke. But make sure that everyone around you understands when you're going to be gone, when you have important assignments that are due that may occupy a lot of your time. I'm talking about the care plan, of course. One thing to understand completely, though, is compared to third semester, there is no preclinical prep for this course. Right? No preclinical prep. For third semester, I know I've taught some third semester courses. I just recently bumped into some third semester students who report that 8, 10, 12 hours of prep the day before clinical is not uncommon. You go to the facility, you get all your information, then you go home and you work all night. Well, that's not going to happen in this clinical. You will arrive to your site, your instructor will hand you your assignment, and then you will have about an hour and 15 minutes with which to prep for your patients. That's right. 75 minutes for as many as 3 patients. Bit of a change, isn't it? That's okay. That's real life. Those of you who work in a hospital, do the nurses that you work with, do they come in hours in advance to prep for their assignments? No. They might come in a few minutes early to find out what their assignment is. But then they get report and they just go at it. Now, that's understandable. They've gone through orientation, they're experienced, they know the hospital, they know the patients, they know the doctors, they know all that foundation information, and you don't. But in advanced clinical practice, the expectation that we have of you is, at this point, you shouldn't need 12 hours to prep for your patients anymore. That information, that knowledge, should be well ingrained inside you, that you can access that and, more importantly, apply it appropriately to your new situation. So that's a big change. It is a big change, and I've had students really struggle for a few days. And if you find yourself struggling with it, talk to me or talk to your instructor and just say, what do I need to do? And my response will be, and probably everybody else's, is you need to prioritize. This is the part of the semester when you start prioritizing a lot. You have to learn what's important. What do you need to know? What's nice to know? And what's unimportant? I'll help you with that. So everyone else will too. You'll quickly learn what you need to know. So this is part of the learning curve. So understand your assignment. Understand the dates of your clinical, and that's the first step of the course packet. There's going to be simulations. Now, those of you that are unfamiliar with simulations, we have high-tech, we call them high-fidelity human patient simulators. These are not the Recessa Annie mannequins that you use in CPR. These are computer-controlled. They have pulses, breath sounds, heart tones, and you can run IVs into them, start Foleys. There's a lot of high-level skills that you can use with these mannequins, and they talk to you, and you talk to them. Now, I'm going to give you some tips right now that will help you maximize your experiences with these simulations. First off, we understand that they're stressful because they are focused, high-level conditions. But treat those mannequins like the real people. Talk to them. Interact with them. I have seen students in the past discuss the patient in great detail while standing over him, saying things that they probably wouldn't say over a real person. Well, that mannequin is a real person, and you will be evaluated as if you are working with a real person. So always remember that mannequin is not made of plastic. It's a real person who has real problems, and you can talk to that person to get answers to help you better care for that person. Do your prep for those clinicals, or those simulations. There are 3 of them. The first 2 simulations are much more of a learning scenarios for you. They're graded. You're graded on how well you reflect on your journal about those simulations. You're not really graded on hands-on performance, because we understand that those first 2, you are learning how to work with that mannequin, how to interact as a team. You know, I can take a student to Holy Family and have them work with a complex patient, and they do a great job. Throw them in a room with other students that they have to cooperate and collaborate together, and they don't do as good because they're not used to that collaborative care. And that's part of what we grade you on. How well do you function as a team? So look at who you're partnering up with. Get together with them. Have a plan. I'm giving you some tips so that you succeed. Have a plan going into those scenarios. Who's going to do what? Make sure you communicate. I'm giving you some advance warning. These are things that trip students up. The third one is the most complex scenario, and that one will be graded on performance as well as planning, cooperation, collaboration, and everything else. But that is a performance-based evaluation. Nothing that you haven't done before, but it's a lot of stuff that happens to your patient. These simulations are, we acknowledge that they're stressful to students. After the fact, though, almost every student I've ever talked to says they've learned a lot from the simulations, that they really enjoyed the simulations after the fact. And at the time, not so much. So simulations, look at those. Take a look at what the resources of the library. You probably are very, very familiar with what's available in the library. If not, well, you might need them. So, you know, look at what's available. They have iPads, they have Nooks and Kindles, and they've got resources. They've got people you can ask questions with. If you have issues with mathematics, and that's not uncommon. I'm one of them, okay? Amanda Sukuwati in the Student Support Center, or Academic Support Center in the library, is awesome at working with you on math problems. So go down there, get some help. And while I'm telling you about going down and getting help, take some time, go to the skills lab and practice. Practice these high-level activities that you maybe haven't done in a while or ever. Make sure you know your sterile field management for dressings and Foleys. Please, sterile field compromising is probably the biggest fault that we see. Central line dressings. We do a lot of central line dressing changes, PICC lines and other central lines. So be familiar with how to do that. The packet that you might be using in the skills lab will, in all likelihood, be different than the packets you'll be using in whatever clinical site you're at, but the skills are the same. So understand how to do that. Look at, make sure you understand piggybacks, IV piggybacks, IM injections, sub-Q, drawing up insulin, you know, oral med administration. You probably have fairly competent skills in that. Proper transfer of patients. SBAR communication. Practice SBAR communication with each other. Situation, background, assessment, and request or recommendation. Yeah, those are the things. If you've got those under control, you'll do fine. You'll do fine. Whatever you can practice in advance of needing it will only help you when you're on the clinical site. Micromedics. Most of the sites have access to Micromedics. Also on your handheld device, you have a variety of resources. Understand how to use them. Clinical, starting clinical is not the time to find a new resource and start learning a new resource. Get used to what you have. Use it. There's a list of all the clinical instructors, our office hours, our emails, our office phone numbers. Use them. Communicate with us. Tell us what's going on. If you're having a problem, tell us now. Tell us early before the problem gets worse. We can work with you if we know about problems. We can't change the world. We can't change expectations. But if we know that there's a challenge, we can find ways to help. But only if we know. So don't hold things back. Don't be embarrassed. Don't be worried. Talk to us. It's so much better for you if you come to us rather than we come to you. Because by the time we're coming to you, the problem is there. Okay? Communicate. Communicate, communicate. Prerequisites, courses that you need to have, obviously, CHA 2 is the big one. You'll probably be taking CHA 2 at the same time. And CHA 2 is a lot of work. So is Advanced Clinical. You will need to prioritize your time in order to do good in both classes, because you need to do good in both classes to move on. And we get that. So make sure that you have study time scheduled. Don't just think, oh, I'll study later this week. Put it on your calendar. Book time consistently to study, both CHA and for your Advanced Clinical. You need to do good in both. Focusing on one or the other will not give you the outcome you want. Some devices that you need to have. Of course, you have to have your handheld device. You need to have your resources on that and have the ability to use those resources. We are mostly looking for some core abilities of critical thinking, integrating technology, and working cooperatively. Now, what do I mean by critical thinking? I'll give you a concrete example. I had a student who went in to do a primary assessment on his patient, and he came out a little while later. He came up to me. I was working with another student. He goes, "I need to talk to you." And I went over there, and we talked, and the student said, I did an assessment on my patient. I got a blood pressure of 90/45 on the machine. I rechecked it manually, got pretty much the same numbers. I had the person was not symptomatic. They were feeling fine. Their pulse was normal, but their blood pressure was low, and they're due to get 3 blood pressure medications in the next hour. I am uncomfortable giving these blood pressure medications because their blood pressure normally runs in the 120s over 70s, and this is a large drop. I want to hold these medications. I went to the staff nurse and discussed this and suggested that we hold these medications and call the doctor. So I wanted to let you know that I'll be calling the doctor for further advice. That's critical thinking. It not only is what that little story demonstrates is assessment, reassessment. So the initial assessment was a low blood pressure. The reassessment confirmed the low blood pressure. The comprehensive assessment looked for everything else, symptomatic conditions and other related cardiovascular problems that could develop. So assessments, decision. So there's assessment analysis saying this is a questionable blood pressure, a decision to not give those blood pressure medications until you get guidance from the doctor, and then following up and actually doing Until you have all of those steps, you really haven't critically thought yet. Just the assessment, well, that's fine, but seriously, just getting blood pressures is not critical thinking. It's a task. Realizing that there's a problem, deciding how to handle the problem, conferring with your peers, your staff nurse, with me about your decision, and then following up and calling the physician and getting follow-up orders. All those steps is what we're looking for now. In fourth semester, you need to understand, you need to be able to do all of those steps all the time for all the situations. Okay? Have I scared you yet? I hope not. But this is the type of situation that you will encounter. Maybe not every patient, nor every day, but you will encounter situations like this. Changes of condition that need action, need you to decide what the action should be. By the way, in this case, the doctor held one of the medications, gave 2 of them, and then ordered a fluid bolus of 250 milliliters of saline to be given. And so the only reason why that was able to happen is my student notified the nurse, and then my student called the doctor. So that's how it works out. You will be talking to doctors in this rotation. If you haven't already, you will this one. Hospitalists, you may be calling specialists. So doctors are very nice. They will almost never bite your head off. Almost never. Go in prepared. Have all of your information with you. Don't have some. Don't guess what the doctor might want. Have all the information ready to go. Practice what you're going to say. Talk to me. Practice with me. Practice with your nurse. Say, here's what I'm going to say, and then say it. You've got a short amount of time for their attention. So give them a brief situation, give them a background on the patient, and then get into that assessment, and then say, here's the problem, what can we do? Okay? So just practice that before you make that call. Textbooks, as before, nothing new there. Carpenito, you'll be using Carpenito for your nursing diagnosis. Need a stethoscope, must have your own stethoscope. You need scissors, bandage scissors, pen light, and of course your uniform as the handbook requires. No changes there. How do we grade? Everybody wants to know how we grade, and sometimes the answer is quite well. Sometimes the answer is quite hard. Specifically in the course packet, we break it down. The dosage calculation and the medication quiz is worth 5%. And as always, we give that right up front, and the first score that you take is the one that counts. You must have an 80%, or you'll have to retake it. You're allowed 3 attempts to take it. After the second one, we will require that you go through remediation, talk to Amanda Sukuwati, do some practice tests, come back and take it when you're ready. You will be doing an in-service. Now the in-service will be held within the group, so you'll be teaching your students and me about an evidence-based practice question. This is sometimes an incredibly interesting experience for the students. I give a lot of, I can't speak for everybody else, but I give a lot of freedom on how the information is presented. So, PowerPoints are common, but I've had people do a lot of hands-on learning. I've had people do YouTube searches for videos to reinforce what they're teaching. I had one student, or one group of students, create a song, a little song and dance to go along with hand skills of hand wash, or scrubbing the hub. It was on scrubbing the hub, and they created their own little song. It's really cool. So this is where you get to be truly innovative and creative. Evidence-based practice, we want you to research something that is evidence-based and compare it to what's going on in the hospital. We'll get more detail on that later on in this course packet. You'll be doing journals every week. And a journal is simply an introspective reflection on how things went, how you felt, what you did, what you'll do differently, or what you'll do more of. Sometimes the students have a difficult time understanding what the journals are for. And I always tell my students, this is where you tell me not only what happened, but why it happened and what will happen in the future. So this is for you to really think about who you are as a nurse and how that influences what you're doing and what you will do. You'll be doing a care plan. One. Care plan is worth 15% of your grade. So that's a chunk. The care plan is more than what you did for third semester. Similar, but more. We're going to focus much more on teaching and discharge instructions because that is a strong RN role. LPNs can reinforce teaching. RNs do primary teaching. So we're going to really focus on teaching and discharge criteria and instructions in this care plan on top of everything else. The whole assessment, the introduction. We're going to look at things, simple formatting, misspellings. Please use spell check. Use your grammar check. Microsoft Word has those buttons. It just frustrates me because the first thing I do is I click spell check. I want to see what errors are there. Now, of course, spell check won't pick up medication spellings. That's fine. But it will pick up a lot of other errors, and I'm sorry, misspellings are a problem when you have such a simple way of ensuring that there is no misspelling. Simulations we've talked about. You'll do 3 med-surg simulations and 1 OB sim. The first 2 med-surg sims are worth 5%. The third one is worth 5%, and the OB is 5%. Clinical evaluation is 50% of your grade, as it should be. This is a clinical course, and we need to focus mostly on your performance in the clinical setting. As before, you will grade yourself for the week using the 0, 2, 4, 5 method. If you give yourself a 5, I want you to reflect in the weekly grid on why you think you deserve, no, why you believe, not think, believe you deserve that 5. If you give yourself a 2, I want you to explain why you're giving yourself the 2 and what you will do to correct that. And do that within the clinical evaluation. Do not do that in the journal. The journal and the weekly evaluation are separate. You might talk about things in both, but that weekly grid, put all that information, that justification and the reflection, and not reflection, the justification and plan for future changes need to be in that weekly grid. If you give yourself 4s, well, you don't have to do any of that. But I still want to see you talk about what happened on the floor. I think it's important for students to really look at what they've done, because sometimes students don't realize how much they do, the complexity of the skills that they do, and the successes that they've experienced. And the reality is, if you don't promote yourself, you're probably not going to get those 5s. Think of this as an interview for a job. In an interview for a job, you better be tooting your own horn and patting yourself on the back and saying all the good stuff you've done because you want that job. Well, if you've done good stuff at clinical, I want you to tell me about it. I want you to say, hey, this is good, and here's why. Now, if we feel what you've done is good, but the simple expected level of performance, we'll let you know and we'll probably reduce it to a 4. Let me give you a specific example. I've had students in the past, generally every semester, at least one student does this. who says, I'm giving myself a 5 for professionalism because I showed up on time in my uniform, ready to go. Well, that's the expectation of everybody, isn't it? I expect you to show up on time in your uniform, ready to go. So you need to exceed that expectation. What's a 5? That's sometimes hard to tell in advance. It's really hard for at least me. Maybe the other instructors have good concrete examples. My best concrete example is when a student catches a med error that someone else made, or a potential med error. Specifically, let's say pharmacy sends up the wrong dose. When the student catches it and says, pharmacy sent up the wrong medication, I'll call pharmacy and fix it. To me, that's a 5 because, again, assessment, they notice the problem. Analysis, they realize this is a big problem, and decision and then action of calling to fix it. That's a 5. Doesn't happen very often, but it does happen. So what are other 5 actions? I don't have anything that I can grab off the top of my head. Possibly when you meet with your instructor at the clinical site, you could ask them, what would you see as a 5? This is more of a way for us to evaluate what you think is a 5. That makes sense? Zeros, that's a problem. Now, let's see. One thing about grading, if you give yourself, if you miss clinical in one day, you need to give yourself a 2, top to bottom and everything. If you miss both days in a week, it's a 0. Okay? Just don't. I realize that there are some things out of your control, but I tell my students, if you have projectile vomiting or a fever of over 103, probably should stay home. If you have a headache and a little cough, show up. I'll put a mask on you. I have shown up for clinicals not feeling good, and I wear a mask. That's just part of the job. Grading scale, 92 is an A, 85 is a B, 80 is a C. That's pretty much standard. Let's see, moving on. What else are we going to look at here? Excuse me. Back to the clinical grids, of course, like everything else, you need to get 4s or better in every category. If you end the clinical rotation with a 2 in any one category, that will be a failure. And in general, students sometimes ask, well, what happens if I have 4s all the way through and then I get a 2 in the last week? Will I fail? And my answer is always, well, it depends. Depends on what's going on. 1, 2, 1 will probably not result in a failure, depending upon what caused it. So we look at trends. We look at growth or lack of growth. So that's kind of how that goes. Also for grading, anything that the packet says assignments not completed by the assigned time will result in a 10% per day grade reduction. So in other words, get everything in on time. You have enough time. We allow you enough time to get the work done. If you don't have enough time, that reflects on time management. Let's see. We talked about assignments. Let's go a little bit greater detail on a few things here. Let's see. I think we covered most of these. Is there anything we didn't cover here? Med errors. You can make 2 med errors. the third med error is an automatic failure. It is possible to make all 3 med errors in one day. I've had that happen with a student. 3 med errors, 3 patients, automatic failure. Does not happen often. It does happen. It happens often enough for us to really reinforce that you need to be prepared for your medication pass. You need to know your resident. I'm right now working in a clinical rotation at a nursing home, so I've got resident on the mind. You need to know your patient. You need to identify your patient. Is this the right medication, right time, right dose, right route? Is it the right everything? Failing to check ID is a med error. Okay? So you can make up to 2. Don't make a third. Don't make 1. Just make it easy. Just don't make any. And you can do that. You can do that. You really can. Have confidence. Go in there prepared and confident, and you'll do okay. We have academic support. We have the support center. Attendance and participation. If you don't attend clinical, it's hard to pass. Can you miss? You can, maybe. It depends. Everything in life it depends. Like in that previous example, all 4s through all the weeks, and then last week you miss a day and you have 2s. Will that be a failure? Probably not. Probably not. But how about the person who's all along and now they miss a day? That might be a failure. You need to be able to demonstrate consistent performance over time. Missing days prevents demonstration of consistent performance. And the reality is you are there for a total of 16 days. 16. That's it. If you miss one day, that's 1/8 or 1/16. That's like 6%. That's a lot of time missing. Missing a week is, you miss a week, you're behind the 8 ball badly. So I'm just trying to be honest and upfront. Don't miss days. If you're going to miss something, call us. Don't email. Call us. Because we need to know as soon as possible so that we can be prepared. And so that we understand what's going on. And don't call me and say, should I stay home? Because I'm not going to answer that. Don't ask me, if I stay home, will I fail? Because I'm not going to answer that either, because it depends. It just depends. You have to decide. And that's the way it goes. A few other rules in the course packet, and no concealed weapons. With your handheld device, texting, the rules vary upon facility. Some facilities allow students to text their instructors saying, help me, I need to pass meds. And I think that's cool. I think it's a good way of communicating with the instructor that gives the instructor visual reminders of what's going on. Here I will say Holy Family does not allow that at all. I carry a cordless phone at Holy Family, so you can call me. Self-reporting, that's pretty much the same. LTC email. Check your email. Check it on a regular basis. I never send emails to home email accounts. Never. I don't. I send them to LTC email. If you don't get your email, that falls under the category of not my problem. So check your email every day. I check mine every day. If LTC decides that the weather requires a cancellation, you will get a text message on that. Hopefully you'll get that before you're en route to the clinical site. If you're at the site and school cancels, well, school cancels. All right. The remaining part of the course packet up front, the academic appeals, the college policies, the nursing handbook, they're like all the other courses. You have that information there. You're expected to follow it. Whether I read it or not, you're still expected to follow it. I'm going to take a break here for a moment, and we'll come back continuing on in the course packet.